2 years ago tomorrow, Maine entered the long, dark tunnel that would be the COVID-19 pandemic.
When Governor Mills, Maine CDC Director Dr. Nirav Shah, and other state officials held that first of so many news conferences, they had no idea how long we'd be in it. We still are, but there are signs it's getting brighter.
Just yesterday, the U.S. Centers for Disease Control released its latest map of COVID-19 transmission levels through every county in the country. The green counties, where transmission is low, pretty much dominate the nation, with pockets of medium and high transmission. Here in Maine, 10 counties are now showing low transmission rates, 5 counties medium transmission, and Aroostook County is the only one in the state still seeing high rates of transmission. Now, usually on anniversary dates, we have a tendency to look back at what we went through, but not tonight.
Yeah, all of us know what we've lost during these last 2 years, whether it was a loved one, a job, or chances at precious moments we'll never get back. Instead, we asked News Center Maine's Don Kerrigan to pose some questions about what lies ahead. Will there be that moment the pandemic is over, or will we just slowly drift back to normal? And it took going back a century for Don to find the answers.
Masks, mandates, vaccines and ventilators, fear and exhaustion. For 2 years, Maine, America, and the world have been fighting COVID-19. The pandemic looks like it could be letting up, but how will we know? There may be some lessons from the world's previous pandemic, the 1918 Spanish flu.
Young people, 20, 30 years old, healthy people, were fine on Tuesday, and they were dead Wednesday morning.
Dr. Richard Kahn is a retired physician and a medical historian. He says the Spanish flu also lasted about 2 years and was terrible. An article from Mercy Hospital in Portland, which was founded because of the flu, says that terrible disease killed 5,000 Mainers and tens of millions worldwide. Dr. Kahn says there was little national medical direction then. States and towns and cities made many of their own decisions how to fight it.
And even within the state, each town, do what you want to do. See if you can get some nurses together and set up little hospitals, places where there weren't hospitals for the 1918 flu epidemic.
He says there were familiar steps taken. Mills closed or reduced numbers, churches shut down services, all to minimize crowds and reduce transmission. There was also the first flu vaccine. Dr. Kahn says there seem to be a lot of parallels between the Spanish flu and COVID-19. In the Spanish flu epidemic, he says it did not end suddenly, just slowly went away as Americans were ready to be done with it. So it just kind of
petered out. Yeah, I mean, I think that's what happened.
And it just drifted into a form that we could live with.
Dr. Megan May is a professor of microbiology and infectious disease at the University of New England. She says with Spanish flu, people did develop some lasting immunity, so it eventually slowed down.
So there was never a moment where people said, the Spanish flu is gone and it's over. The H1N1 strain continued to circulate for years after that, but it just didn't cause that same horrific level of infection because there was some level of population immunity to it.
And that, Dr. May says, is the big difference with COVID-19. She says people who get COVID do not develop lasting immunity.
Your natural immunity to not just COVID-19, but most coronavirus diseases is very, very poor.
And while COVID may seem to be backing off right now, she says another variant could easily come after us again.
I don't think we have a basis for predicting if it will be more or less virulent at this point. And if somebody is saying that they do, I respectfully disagree.
As for Dr. Kahn, the medical historian, do you think we are at or near the end of this pandemic, this epidemic?
I would, I'll say, I think we're heading there, but I'll hedge my bets, because whether there's going to be Omicron, there's going to be some other Greek letter that jumps up. It's possible. But as I said before, there's the science, medical on one hand, and then the socio-political. It may be there is going to be one, and everybody's going to say, I've had it. I'm not going to have my kids wear masks. I'm not going to wear a mask. So whatever happens, happens.
The lessons from history only take us so far. In Tennant's Harbor, Don Carrigan, News Center, Maine.